Hello, how are you doing? My name is Steve Edwards and welcome to this week's video blog. The last video blog was on the communication that you should be having with your patients or parents concerning the coronavirus. Well, guess what? We're doing another one on the coronavirus. Today we're going to talk about what you can do in preparation of a quarantine. If you live in a certain area and a lot of coronavirus has been around there, they could lock down your geographical area. What happens to your clinic? So that's what I want to talk about today. So I want to clarify some terms real quick. Telemedicine and teletherapy. Teletherapy is what you do every day. This is for therapists, and that is using a video call to provide a therapy service. Telemedicine, as it relates to this video blog, is going to be the general term from insurances and Medicare. And you'll hear these terms throughout this video blog. So first, I think the best thing for a clinic to do is have providers and admin staff start to communicate with patients and find out who would be even interested in receiving teletherapy. Not all patients are conducive to a good video teletherapy session. So, between the therapist, the patient, and/or parent, you could probably identify if that patient is a good candidate. Do they have internet connection? Do they have a computer? All those kind of things that are going to wrap up into making that determination. As a clinic owner, I would have a document that they can go out and kind of lead them through these discussions with their patients, so you control the message. The biggest thing I can tell you today on this video blog is control the message that your providers are having with your patients or parents, or your admin staff is having with your patients or parents. You might even consider sending out a letter to all of your patients. And I know that is going to take a while and you have to mail it and all that kind of stuff, but your patients and or parents are looking at you for guidance through this as it relates to the therapy session. So take the lead and give them what they need, and that is leadership. So by the end of that first part, you should have a list by provider of the candidates for teletherapy. That way you know, hey, I have 10% of my clinic that is conducive to teletherapy. I have 50%. So you kind of know the impact this might have on your clinic and what you need to do in preparation of providing this service. Now let's talk about payments. Medicare, if you are having in the Medicare does not cover teletherapy. They do cover telemedicine if it's in a rural area and stuff like that. Most commercial carriers are not going to cover teletherapy. We've called many of them, and Cigna was the only one that said that they cover it. And I haven't seen that in writing, so I'm not really comfortable saying, hey, treat all your Cigna recipients, because there's also EvaCore as part of that. So, excuse me, ASH, not EvaCore. ASH is part of that, and we don't know that they would cover teletherapy. So now let's talk about Florida Medicaid. Florida Medicaid, per the contract between ACA and the MMAs, they have to cover teletherapy. I can tell you with 100% certainty that most of them are not set up to pay right out of the box teletherapy. We can get some denials. WellCare seems to be the only one that accepts the teletherapy location code, which is 02. And the modifiers now. And it took them a long time to get their stuff together to be able to pay that teletherapy. Most of the other MMAs, you're going to find that you're going to have to bankroll. From EEP's standpoint, if it's denied, we will send in the appeal with the proper documentation to try to get them to pay it. But there's no telling on when that will unfold. So you could find yourself with a lower patient count, providing teletherapy, having to appeal every one of them, and you having to bankroll, that therapy. So, and I know that's not a very good thing to tell you, but I want to prepare you for this. So now let's talk about the platforms for teletherapy. Most people, a lot of people, they're not using a EMR that has teletherapy in it. They're using Zoom or Skype. Let me tell you something really quick. If you are getting Zoom for free, I can tell you with 100% certainty, it is not HIPAA compliant. Anything for free or at a fraction of the cost is not going to be HIPAA compliant. So the biggest thing I can tell you is to make sure that you're HIPAA compliant on the video that you're actually going to use. But again, most people use that Zoom or Skype. Let's talk about the requirements for documentation. Inside of TheraPlan, inside the case or inside documentation, we have the ability to categorize that session as teletherapy. The location code is 02. That doesn't mean anything. Just put teletherapy on it, and it's going to put the location code on your documentation as teletherapy. Now, there's also some requirements in looking at the ACA handbook along with the WellCare handbook that you have to have on your documentation. We're going to talk about those right now. Add to the documentation why teletherapy is being used in this case. That's obviously easy. The coronavirus, and it depends on how you're going to word it inside the documentation, but that's an easy one. You're providing teletherapy because of the coronavirus being in your area and there was a quarantine. Second, the equipment that you used. I used a Dell computer with a Dell monitor, with this microphone, with this video, and I used Skype. Whatever that looks like, you want to make sure that that is on your documentation. You also need a document signed by the patient or the parent that says that they know that you're performing teletherapy and that they agree with receiving that teletherapy. So you need something from your client, your patient, that says that yes, they are on board with teletherapy. Now, what I would do is the first two, I would make sure that you control that message, what they used, along with why you're giving teletherapy. Have it like on a Word document where they can copy and paste that right into the first comment box inside of TheraPlan. That way you have everything that you need inside of the documentation, and then the document that they sign, you can just upload that right into TheraPlan documentation, and you'll be good. Make sure that you're planning for this. This is why I'm putting out this video blog. You need to plan and make sure that you are seen as the professional in the eyes of your patients and parents. Make sure that they know that you have a plan, and that if this does happen, which Lord willing it won't, that you have a plan that you can execute and make sure that they are getting the services that they need when they need it. So thank you for watching this video blog. I hope that this creates an atmosphere in your clinic that you can discuss these things, make a plan. If you need any help, give me a call. Let's discuss it. I know that I'm receiving a lot of emails about teletherapy, which is why I'm putting this out for you. I hope that you can make that plan and execute it. Thank you for watching this week's video blog, and have a great day.